Hi, and welcome to Bassett Unified's employee training on COVID-19. This training was developed using the guidance from the Los Angeles County Department of Public Health. This presentation is based on both the reopening plan and the Center for Disease Control Health Guidelines. Learning objectives. After participating in this training, you will be able to demonstrate an understanding of COVID-19 and how it spreads, use strategies for minimizing risk of exposure in the workplace, recognize potential signs and symptoms of the virus, report and respond to potential exposure of COVID-19. This training will also cover best practices for health and safety in the workplace, health screening protocols, and Families First Coronavirus Response Act. So what is COVID-19? Coronavirus disease, COVID-19, is an illness caused by a virus, the SARS-CoV-2, that can spread from person to person through respiratory droplets. Why the name COVID-19? CO stands for corona, VI for virus, D for disease, and 19 for 2019. The virus that causes COVID-19 is a new one, novel coronavirus, that has spread throughout the world, making it a pandemic. COVID-19 symptoms can range from asymptomatic or no observable symptoms to mild or to severe illness. How COVID-19 spreads. Coronavirus is spread through person-to-person contact between people who are in close contact with one another within 6 feet for 15 minutes or more. Through respiratory droplets produced when an infected person coughs, sneezes, or talks. Those droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. Through touching contaminated surfaces and then touching your face, nose, eyes, or mouth.
How to protect yourself and others. Prevent the spread of COVID-19. Cover your cough and sneezes. If you use a tissue to cover your cough or sneeze, discard it and wash your hands. Wash your hands for at least 20 seconds. Avoid close contact with others and maintain physical distancing of 6 feet or more. Clean and disinfect frequently touched surfaces. Wear a mask or facial covering. Older adults or people of any age with the following medical conditions are at increased risk for severe illness, including the following: asthma, moderate to severe, cerebral vascular disease affects blood vessels and blood supply to the brain, hypertension or high blood pressure, immunocompromised state, neurological conditions such as dementia, liver disease, pregnancy, pulmonary fibrosis, having damaged or scarred lung tissues, smoking, thalassemia, a type of blood disorder, and type 1 diabetes.
Signs and symptoms of COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Watch for symptoms. Call 911 if you experience any of the following: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. Notify the 911 operator that you are seeking care for someone who has or may have COVID-19. Reopening protocols and procedures. All K-12 schools in California counties that are in Tier 1 of the state's blueprint for economic recovery, including Los Angeles County, will be monitored. California Department of Public Health recommends that the case rate be below 100 cases per 100,000 residents before schools reopen. The reopening protocols are fluid and are updated as new information becomes available. BUSD protocols will change as needed to meet all public health guidelines. Protocols from the Los Angeles County Health Department are not optional and take precedent over guidelines given by the California Department of Public Health or the CDC. The decision to reopen schools is based in large part on the case rate in the county. How many cases per 100,000 residents? Health screenings. Prior to leaving home, students and employees must do a self-check for symptoms of and exposure to COVID-19. If any signs or symptoms of COVID-19 are noted, or if they have recently been exposed to someone with COVID-19, they should stay home. All visitors will be screened prior to entering school sites or district offices. Temperature checks may be performed prior to entry to a school site or district office. Temperature screenings will be conducted using a touchless thermometer.
BUSD workplace protocols. Before arriving to the site, all staff are required to conduct a health screening. If you answer yes to any of the health screening questions, you'll be directed not to report to work and call your supervisor. Staff entering a site must be pre-approved by their principal or supervisor and can only access their workspace during pre-approved dates and times. All staff must remain in their own workspace unless using the restroom or exiting campus. Physical distancing protocols, 6 feet between persons, must be observed at all times. Staff must not congregate in common areas including hallways, break rooms, or lunch rooms. BUSD workplace protocols continued. Face coverings must be worn at all times while on site, unless you are isolated in your office or classroom. All staff must frequently wash hands with soap and water for at least 20 seconds. Shared microwaves, coffee makers, and other non-essential equipment may not be used. Disinfect and hand sanitizer will be provided near shared work equipment. Staff must disinfect all touch surfaces after use. Use of restrooms must be limited to one person at a time. Children of staff members or other non-approved visitors are not permitted at school sites or the district office. The following is a questionnaire that you will fill out before arriving to your school site. Questions for self-screening. Name and work site. Have you had any of the following symptoms first appear in the last 10 days? If you check any of these symptoms, do not report to work. Contact your healthcare provider and your supervisor. Fever, temperature at or over 100.4 Fahrenheit. Chills, cough, shortness of breath, difficulty breathing, or I have had none of the above symptoms in the last 10 days. Have you had contact with a person known to be infected with the novel coronavirus, COVID-19, within the last 14 days? If you answer yes to this question, do not report to work and contact your supervisor. If any answer yes to any of the above questions, do not report to work and notify your supervisor. What to do if you are exposed.
Quarantine versus isolation. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. If you have been in close contact, been exposed to a person who is positive for COVID-19, you will be placed in quarantine. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Quarantine helps prevent spread of disease that can occur before a person knows they are sick, or if they are infected with the virus without feeling symptoms. Isolation. Isolation separates sick people with a contagious disease from people who are not sick. Stay home and stay away from household members. Do not go to work, school, or public areas. If you have tested positive for COVID-19 or experience COVID-like symptoms, you will be placed in isolation. If you must leave home to get essential medical care, drive yourself if possible. If you cannot drive yourself, keep as much distance as possible between you and the driver and others. Example, sit in the back seat. Leave the windows down and wear a mask if possible. If you do not have a mask, wear a cloth face covering. If someone from outside your household is shopping for you, ask them to leave the food and other supplies at your door, if possible. Pick them up after that person has left. What is a close contact exposure? A close contact is any of the following people who were exposed to an infected person while they were infectious. An individual who was within 6 feet of the infected person for more than 15 minutes. An individual who has had unprotected contact with an infected person's body fluids and or secretions, for example, being coughed or sneezed on, sharing utensils or saliva, or providing care without wearing appropriate protective equipment. An infected person is anyone with COVID-19 or who is suspected to have COVID-19. Considered to be infectious from 2 days before their symptoms until they are no longer required to be isolated, per Los Angeles County Department Health Guidelines for Isolation. A person with a positive COVID-19 test but no symptoms is considered to be infectious from 2 days before their test was taken until 10 days after their test. So, here are some guidelines and actions you can take if you suspect you have been exposed or infected. I am COVID-19 positive. You need to isolate. I've had close contact with someone that is COVID-19 positive. You need to quarantine. I may have been exposed to someone with COVID-19. Monitor symptoms and maintain physical distancing. If symptoms develop, follow isolation guidelines. I have symptoms of COVID-19. You isolate. I've been exposed to someone who's been exposed to someone who tests positive for COVID-19. Monitor symptoms and maintain physical distancing. Again, if symptoms develop, follow isolation guidelines. How to calculate when your quarantine period ends. You will need to stay in quarantine for 14 days from the date that you last had close contact with an infected person. Number 1. You have no further contact with the infected person. Your last day of quarantine is 14 days from the date when you last had close contact with them. 2. You continue to have contact with the infected person. If you can avoid close contact, your last day of quarantine is 14 days from the date the infected person or persons in your household started to follow home isolation instructions for people with COVID-19. If you have any close contact with that person at any point, the 14-day quarantine period will have to restart from the last day that you had close contact. You received a quarantine order but don't know when you were exposed. Your last day of quarantine is 14 days from the date of issue on the order. When does my home isolation end? If you had symptoms, you must stay home and isolate until at least 10 days have passed since your symptoms first started. Contact your health provider if you have medical condition. And you have had no fever for at least 24 hours without the use of medicine that reduces fevers. And your respiratory symptoms have improved, for example, cough or shortness of breath. And if you tested positive for COVID-19 but never had any symptoms, you must stay home for 10 days after the test was taken. But if you develop symptoms, you need to follow the instructions above.
What is contact tracing? Contact tracing is used by the health departments to prevent the spread of infectious disease. In general, contact tracing involves identifying people who have had an infectious disease cases and their contacts, people who may have been exposed, and working with them to interrupt disease transmission. For COVID-19, this includes asking cases to isolate and contacts to quarantine at home. School nurses and health assistants will be trained in contact tracing and may assist the health department in this activity in the event of an exposure. COVID-19 testing. Free testing is available to all county residents regardless of insurance status. If you have health insurance, your health plan is required to pay for the improved COVID-19 tests. By providing your insurance information, this allows the county to be reimbursed for the cost of the tests from your insurance company. Check with your healthcare provider if you think you need to get tested. It's always best to work with your healthcare professional to determine the kind of care you need, just as you would with any other healthcare concern. If you don't have a doctor, call 211 to get a referral. A COVID-19 test does not protect you from the virus, and a negative result should not be seen as a reason to engage in risky social behavior. A COVID-19 test does not guarantee that you do not have the virus. A false negative test is possible. Even when accurate, a test result only reflects whether you have the virus at the moment you took the test. You could become positive at any time, and an exposure to COVID-19 could happen immediately following your test.
Protect your health. Personal protection equipment, PPE. Cloth face coverings required for all students and staff as mandated by LA County Department of Public Health. Cloth face coverings will be provided to students and staff. Appropriate levels of PPE, medical grade masks, surgical masks, cloth face coverings, face shields, gloves, and gowns will be given to staff and or students based on required duties and or student need. Staff who need to work closely one-to-one with students, for example, nurses or health or instructional assistants, staff who provide specialized healthcare procedures, students unable to wear a cloth face covering due to a health problem or unable to independently remove a cloth face covering. Face coverings are required in Los Angeles County. Why are face coverings required? They reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes, including someone who has COVID-19 but feels well. Face coverings decrease the risk of transferring COVID-19. Individuals with COVID-19 may be infectious 48 hours before they become symptomatic. Who is exempt from wearing cloth face coverings? Children under the age of 2. Children between the ages of 2 and 8 years should wear a cloth face covering under adult supervision. Those with breathing difficulties. Those instructed by their physician not to wear a cloth face covering. Anyone who cannot independently remove a cloth face covering. And anyone who is incapacitated or unconscious. Individuals who are exempt from wearing a face covering due to a medical condition and who are employed in a job involving regular contact with others must wear an alternative, such as a face shield with a drape on the bottom edge. What is considered an acceptable cloth face covering? The district has purchased and is able to distribute 2 cloth face masks for every employee. Staff may use personal face coverings. Decoration or writing on masks must not violate dress code regulations. Acceptable reusable face covering options for the general public include a bandana, a neck gaiter, homemade face covering, a scarf, t-shirts, and some types of towels. Masks with one-way valves should not be used. Proper use of cloth face coverings. To wear your face covering correctly, wash your hands. Pick up the face coverings by the head or ear strings. Loop the strings over the top of your head or around your ears. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily and wash your hands. Proper removal. of cloth face coverings. Wash your hands. Untie the strings behind your head or stretch the ear loops. Handle only by the ear loops or ties. Fold outside corners together. Be careful not to touch your eyes, nose, and mouth when removing. If you need to reapply your face mask, set it on a clean paper towel or paper bag. Wash hands immediately after removing. How to wash face coverings. To wash your face covering correctly, cloth face coverings should be washed after each use. You can include your face covering with your regular laundry. Use regular laundry detergent and the warmest appropriate water settings for the cloth used to make the face covering. To dry your face covering correctly, use the highest heat setting and leave it in the dryer until completely dry. Air dry. Lay flat and allow to completely dry. If possible, place the cloth face covering in direct sunlight.
Donning or doffing multiple PPE. Putting on donning PPE. Identify and gather the proper PPE to don. Make sure you have the proper size or sizes. Wash hands. Put on gown if needed. Make sure ties are secure and gown covering body correctly. Ask for assistance if needed. Put on mask if not already wearing. Only touch the ear loops, ties, and the nose piece if needed to fit the mask. Put on face shield or goggles. Put on gloves. Gloves should cover the cuff wrists of gown. Removing or doffing PPE. Remove gloves. Ensure gloves removal does not cause additional contamination of hands. Remove gown. Untie all ties or unsnap all buttons. Reach up to the shoulders and carefully pull gown down and away from the body. Rolling the gown down is an acceptable approach. Dispose in trash receptacle. Wash hands. Remove face shield or goggles by grabbing the strap and pulling upwards and away from the head. Do not touch the front of the face shield or goggles. Face shields that need to be reused should be cleaned and disinfected. Remove and discard face mask if needed. Do not touch the front of the respirator or face mask. Cloth face coverings should be placed in a bag. Wash hands. Donning. For respiratory protection, use a surgical mask or above. For eye protection, use goggles or a face shield. Doffing. Physical distancing. Physical distancing, also called social distancing, means keeping space between yourself and other people outside of your home. To practice physical distancing, stay at least 6 feet, about 2 arm lengths, from other people. Why do we need to physical distance? Droplets from a cough, sneeze, or exhalation can spread at least 6 feet. Yuck. If you are wearing a mask and maintain a physical distance of at least 6 feet, you will minimize your risk of exposure to COVID-19 and other illnesses. Hand washing. Wash hands with soap and water for 20 seconds. Wash hands upon arrival and when leaving the facility. Wash hands after using the toilet or changing a diaper. After helping a child wipe their nose. After you sneeze or cough. After helping a child with the sandbox. Hand sanitizers are less effective than hand washing in preventing COVID-19. Family First Coronavirus Response Act. Employee paid leave. The Families First Coronavirus Response Act requires certain employers to provide their employees with paid sick leave or expanded family and medical leave for specific reasons related to COVID-19. Does not come out of the employee's sick or leave bank. Contact BUSD Human Resources.
Cleaning and disinfecting. Clean high-touch surfaces frequently, at least 3 times a day and as needed. Desks, light switches, door handles, doors, keyboards, sinks, phone, chairs, toilets, tablets, countertops, computer mouse, faucets, tables, handles, bathroom surfaces. Appropriate PPE should be worn when using cleaning products. Only approved cleaning products should be used. Products must be used as directed. Limit sharing of supplies. Water fountains should not be used. Students and staff should bring their own water container. Identify activities that have less contact with high-touch surfaces, i.e. limit playground equipment. Play structures may be used by small cohorts. Clean between groups. Thank you for completing the COVID-19 training for Bassett Unified School District. To get your certificate of completion, please follow the link here and take the quiz. Your scores will be automatically tabulated and your certificate sent to Human Resources.